So I'm going to go ahead and get started because we're covering a lot of stuff in this hour, and I want to make sure that everyone has enough time to talk about the resources, and then we have enough time at the end for a Q&A. So good morning, everybody. Thank you so much for joining us for our very first virtual caregiver workshop. My name is Candace Christensen. You've probably seen my name come across your inboxes. I'm the coalition coordinator for the Caregiver Coalition. And we started these virtual caregiver workshops to try and bring the caregiving experts right into your living room while also maintaining this physical distancing protocol. We hope that you leave the session feeling more supported by the agencies here locally and your fellow caregivers. We're going to have a lot of caregivers joining us, and it's important to remember that you're not alone, and the social distancing doesn't mean social isolation. So I'd like to go ahead and introduce our panel of experts that are joining us this morning. We have Toula Wootan. Toula, if you want to give us a wave. She is the founder of the Caregiver Coalition and Toula's Tips for Caregivers. We also have Justine Conley. She's the Associate State Director for AARP Florida. And we have Lori McMullen. She's the Director of Development at Aging True Senior Services. And Milva Ballester. She's the Program Manager at the Alzheimer's Association Central and North Florida Chapter. So just to go over a few housekeeping things, the session is being recorded. It's going to be posted to our website. We've turned off everyone's microphone and camera except for those of the panelists. And if you could please leave the microphones and cameras off just so we have as little distraction as possible. If you haven't already, it might be helpful if you turn on speaker view in the top right of your Zoom screen. That way, it might be a little less distracting. It's just the speaker that has the kind of that big picture in the center of your screen. Another thing, if you find yourself with any questions during the first half of the session, you can type them into the chat box and we'll make sure that they get answered. When we do begin the Q&A session towards the end, please use the hand raise button. We can answer as many as we have, or as many as we can in the time that we have. You can access this by that black bar at the bottom of your screen if you select participants. And then the window that opens on the right-hand side, there's some reactions there at the bottom, like yes and no. There's 3 dots, you click that and it should have the option to raise hand. Let's see, after the session, if you look out for an email from us, it'll include a short survey on what you liked and what you didn't like. And then lastly, the number of attendees that we have a lot. So we may run into some technical difficulties. And if we do, we're learning, we're gonna resolve them as quickly as possible, but we're all kind of in new waters here. So I'd like to go ahead and give Toula the opportunity now to share about caregiving during COVID-19. She's got some really practical tips on handling the stress and uncertainty during the crisis. Go right ahead, Toula.
Thank you, Candace. And I don't really need that script till a little bit later in my presentation, but that's okay. Let's just leave it. I like the guy in the picture. He's kind of cute. Thank you. I am Toula Wootan, and as Candace mentioned, I am the founder of the Caregiver Coalition and have a radio show called Toula's Tips for Caregivers. And when I think of what we're doing today and how we started the Caregiver Coalition in 2008, and that we've done something like 70 physical in-person conferences since then, all I can think now is we've come a long way, baby. That slogan just came to me as you were talking, because now here we are using technology to, as you said, come into everyone's living room. So I'm proud of you and all the Caregiver Coalition partners. Look what we're doing today to reach caregivers. So caregiving, we know, has its own set of challenges. Physical challenges, physical exhaustion, mental, emotional challenges, financial challenges for sure. And now we've got COVID-19, new restrictions, new policies, and things that we can and can't do in our lives. So I did want to talk about that just a little bit. And I'm going to give some information on how to stay connected. Can you still hear me okay?
Yeah, Yeah, Toula, you got a little bit garbled for a second, but I can hear you.
Okay, because I got a notice about my speaker not working well. So anyway, as long as you can hear me, we're good. So let's talk about a couple of ways to make this road a little bit easier during COVID-19. A couple of practical things that we can do. One is to just plan ahead. Make sure that your loved one who you are caring for has all their prescriptions and all their over-the-counter medications at hand, a good 2 to 3 months worth. Pharmacies are now filling, if you request it, a good 2 to 3 months worth of prescriptions because of the COVID-19 crisis that we're going through. One of the things I always stress, whether it's COVID-19 time or not, is be firm and ask for support when you need it. There are people out there who want to help you, as Candace mentioned, and you've got a lot of them on this Zoom conference today. One thing I learned by experience is to call ahead before you go to your doctor's appointment. It may not be an in-person appointment. It may be a telehealth medical appointment. So always make sure you call before you go to make sure what kind of appointment you have. And then one practical tip to help caregivers at all times is know what to expect at every stage of your loved one's disease. Do the research, find out what's going to happen as time goes on or as they decline. So you will know what to expect and not be afraid. Again, I always say it's really important to have all your medical information organized and in a place where it's really easy to find when you need it. There are also some care apps out there that can help you with that. We can talk about that towards the end if you like. Financial and legal documents, same thing, know where they are and know how to get a hold of them. Advanced directives, really important to have those in place. And again, know where they are. And one thing I talked about with a caregiver this week is prepare for possible quarantine. What happens if you or your loved one get this disease? What are you going to do? Are you going to live in separate rooms? Are you going to have to find respite for your loved one at a facility? Just know what to do if that happens. Have a plan. So some of the specific stressors that COVID-19 has placed on all of us, but are particularly hard for caregivers, is the infection control measures. Have you ever washed your hands so many times in a day? I am one of those people that washes probably 50, 60 times in a day anyway, and now I'm so cognizant of it. It's more than that, and my hand sanitizer is with me everywhere I go. That is an added little stressor, but it's a stressor. And then if you're caring for someone who maybe has some dementia and just doesn't want to do it, and you've got to fight them a little bit, you know, sometimes people with dementia don't really care for running water, and it's a struggle to be able to do that. So find practical ways to be able to do that. Make sure your loved one washes their hands as much as you do. We talked about the term social distancing. That has posed a real stressor for caregivers, and I like that Candace said we're changing it to physical distancing because I don't like social distancing. One of the things caregivers and our older adults face already without COVID-19 is social isolation. That is the last thing we want for them. So I'm gonna ask that we use the term physical distancing. And then when we close, I'm gonna give you some ways to connect with others. Another stressor that we're all facing, and I had a conversation with a friend yesterday about how some people are just so adamant against it, is wearing a mask out in public. You know, that's one more thing to remember to do. I don't understand why it's such a big deal for some people. It's there to protect you and others, but yeah, it's one more thing to do. A lot of places that we are used to frequenting and enjoying are closed. We can't get together with our friends the way that we used to. I don't know about you, but that's been a little bit hard for me, so I know it is for caregivers as well. One of the other stressors that I think is really playing on everybody's psyche and soul these days is just the uncertainty of this disease, the timeline of this disease, the impact of this disease. We don't know when it's really going to wind down or stop, or if it stops. I read a report from the World Health Organization the other day that said it's probably here with us to stay. And we're going to have to learn some ways to get the medicines, get the vaccines, and ways to cope. The imposed quarantine that we've already talked about has definitely imposed some new stressors for caregivers. We don't want you to socially isolate, so we're going to give you some practicalities on that. We know that there's so many millions of people in our nation who have lost their jobs due to this, and with that comes, of course, loss of income, and for so many, loss of insurance. I just read a study this week that said 28 million people in our nation have now lost their insurance because of their job loss. And here they are trying to take care of a loved one with no job, no money coming in, and possibly no health insurance for themselves. To do that, that is, again, an extra added strain for caregivers. Studies show that caregivers spend about $7,000 a year taking care of their loved one. Where's that money going to come from if you've lost your job? All of this leads to increased anxiety, stress, and even grief. And yes, grief counselors are talking to caregivers and to frail elders because this is a time of worry and anxiety. We have so many things that we are facing. One of the practical things that I've done for myself and I like to advise caregivers to do for themselves is just watch less news. You know, when all this first started, I was probably watching the news 3 times a day, and they have a tendency to focus on the negative and sensationalize, and it can get your anxiety kind of ramped up. It did me, and I realized I got to stop this. So watch less news. Know what you need to know. Stay informed so that you can be prepared, but don't spend your time in front of the TV. Another practical thing that I like to tell caregivers is it's really okay to give yourself a break. Maybe even lower your standard just a little bit. If mommy used to always be dressed by 8 o'clock and fed by then, give yourself a break. 9 o'clock, 10 o'clock is okay. You don't have to hold strict regimens anymore. Nobody is. You can't during this time. Pamper yourself. Do something for yourself. If it just means going out into your garden and looking at your flowers or reading a book, one of your favorite books for 10 minutes a day, do something that is just for you every day. And I did mention that a lot of counselors are helping caregivers and our older adults these days. If you feel like the anxiety of this whole situation is getting to you, or you are grieving and you need help, please reach out. Any of us on this call today would be happy to help you and point you to the right resources. Back to social isolation, and this is where the screen that she has up is really important. I don't like that term. It's physical isolation. We want you to stay in touch with your family and your friends, and technology gives us so many really pretty easy ways to do that these days. Most of us have our cell phone in our pocket all the time. You can call your loved ones, you can call your family, you can even see them on your cell phone these days through FaceTime, or you can Skype them. A lot of people are doing that. On the internet, there are a lot of caregiver forums where you can chat with other caregivers, be it Facebook or Instagram. And then we're going to talk about some other ones today that some of our agencies have. You know, the motto that I keep hearing on the news when I do watch it is, we are in this together. Remember that. We are in this together. You can't do this alone, and we don't want you to. So Candace, go to the next slide for me. I am going to talk about some hotlines that have been created specifically for this time to help people get through this very stressful time. Aging True, which is local here in Northeast Florida, for Duval and Clay County, put together a telehealth counseling program, and that is 24/7 with licensed mental health counselors and social workers there to answer the phone, help you discuss your fears, your worries, your anxieties, and give you help to get through this. ElderSource, who is with us today, of course facilitating this, also has a hotline for caregivers and for older adults. Since it's on your screen, I'm not going to take the time to read the numbers because I know my time's limited, but we'll have it up again at the end of the presentation. Lutheran Services Florida did the same thing for caregivers, another hotline 24/7 so that you can access someone who can help talk you through this situation. The Alzheimer's Association, critical for all of us who are caring for someone with any kind of dementia, particularly Alzheimer's. Utilize these. The next one says AFA, the next screen, Candace. which is the Alzheimer's Foundation of America. They also have licensed clinical social workers available 24/7 to talk you through, to help you. And that really is all the time. It's not just through this pandemic, they've always had it. And then the Caregiver Action Network put in place specific for this pandemic, counselors to be available to you. There are people out there who want to help you. Please avail yourself of it. I know it's a scary time. None of us really know what's coming, and it can be frightening. But if there's any word I want to leave you with, it's a word of encouragement that helps me. And that's the acronym for the word hope. Hang on to this. Hope. Hang on. Pain ends. Hope. There will be an end to this. One way or another, we will have a new normal. The sun's going to shine. We will all go back to some sort of getting together again, as we always used to. And life will come back to some sort of a normal. So hang on to hope. Never lose hope. And remember, you're not in this alone. We're here for you. Oh yeah, there's my free report. As I mentioned, I've been helping caregivers since about 2008. I've got a few documents. I've got a website, Toula's Tips for Caregivers. And one of them that I've put together is just a free document to you that I'll be happy to send you, called 7 Days to Become a Better Caregiver. It gives you 7 different tips on how to better care for yourself as you're caring for your loved one. Critical importance there, obviously. And then different ways that you can better take care of your loved one. And again, you can email me at Toula at toulastipsforcaregivers.com. That's my website. If you decide to go to it, toulastipsforcaregivers.com. I have 10 years worth of radio shows on that website. And I cover every topic related to caregiving that you could think of. So avail yourself, contact me. I'd be happy to help you as well.
Thank you so much, Toula. That was a lot of information, a lot of really great tips. We really appreciate that. And again, this session is being recorded. So to any of our caregivers viewing, if you jumped on a little late or if you missed a few things, you can go back and rewatch it. We're going to be posting it to the website. So I'd like to open the floor up now to our experts. They all have excellent resources that they want to share with you. Again, if you have any questions during their presentations, go ahead and put them in the chat box, and then I'll make sure that at the end in our Q&A session that those questions get answered. So we're going to start off with Lori McMullen. She's the Director of Development at Aging True Senior Services. Lori, what resources do you have for caregivers during the current crisis?
Oh, quite a few. And I have to say, I am brand new, 2 months, and super excited to be with Aging True because we provide essential and innovative resources to individuals and families to prepare for and support graceful aging. And that mission is just, I think, near and dear to everybody's heart, especially right now. And we've served over 6,000 clients in Northeast Florida. We've been around for about 60 years. So we are here to help you. As you can see, I keep pointing, but on our on the PowerPoint there, we have a list of services, but they even fall into buckets of home health, nutrition. You've heard of Meals on Wheels, I'm sure. Community care, which is more what we're going to talk about for you all, and independent living. I'm kind of going to take a two-prong approach because we are in a pandemic now, but we also have to look to the future for other resources. And if you aren't plugged into Aging True, you need to know about them, how we traditionally provide services, because it's something that you might want to look into by calling 904-807-1203 and getting plugged in. But Meals on Wheels is something that if you are in our Clay and Duval area, you might be able to take advantage of if your loved ones are partaking in that. Caregivers may also be able to get some meals also. So that's something that I wanted to make you aware of. You might not know about that. And also in community care, I mean, traditionally we have training and education, some workshops and different things when we get to convene and meet, and newsletters about how to help you take care of your loved ones, but also yourselves as well. As we keep talking about that, self-care is super important. Well, now we do have people who can help you with some virtual and other means of support until we can get past this pandemic on that end. And we do traditionally have respite care. So I want you to be aware of that. That's something that you will want to tap into, where we have volunteers that can give you a much needed break to have that self-care for yourself so that you can take care of your loved ones as well. And on that note, we talked about the telehealth that we launched, and it's not just in Duval and Clay County. I know we do cover Volusia as well, and perhaps beyond. If you do not have access to a smartphone or an iPad or something that most of you must, because we're here on the Zoom right now, or internet, we can help you with that as well. But Claudio Ventura is our mental health director, and his direct number is 904-807-1243. That's 904-807-1243. And there's an assessment intake on the front end that we can plug you into some much needed services there as well. And something that you may not be aware of is our Relatives as Parents program. So, you know, a lot of us are in the sandwich generation. Perhaps you are taking care of an elderly loved one, but you might have children, your grandchildren or some other relative living with you now that you weren't anticipating, and you're their primary caregiver as well. We have a support system for that, including in normal times, stipends for summer camps and other support groups that meet. But we've been able to bring some additional food over to some of our grandparents and relatives while they're homeschooling their children, and other things to keep them going and plug them in with support. And that program actually is open to relatives who are 55 and up. Typically, our programs for client services is 60 and up. Now with caregivers, what you all might need for support, that's not the same age issue. But in case you didn't know about that, I'm learning something new every day, and I was really jazzed up to hear about the Relatives as Parents program. But there are just many, many programs that are there to potentially help you and your loved ones. And please give us a call at 904-807-1203. That's our main number, 807-1203, area code 904, and we'll get you plugged in.
Thank you, Lori. Like she said, Aging True is such an important agency for seniors and their caregivers to plug into. So we have the main line, the main number there. We also have the website there, and you can get some more information on the different programs that they offer just from their website. Aging True's done a fantastic job adjusting their resources to the clients and making them accessible virtually. So thank you so much.
Thank you.
Next, we have Justine Conley. Justine's the Associate State Director for AARP Florida. Justine, how is AARP supporting caregivers during our COVID-19 crisis, and what resources have been created in response? Hold on, you're still muted, Justine.
Can you, how about now? Wonderful.
I can hear you.
Thank you. Good morning. It is always a pleasure to be a part of the coalition and what the coalition is doing. And AARP, is a 60-year-old advocacy organization. So one of the first things we did, we were an in-person information organization. And so a lot of things we've done. So we've had to pivot. We pivot very quickly to virtual and trying to provide our resources virtually. So one of the things that AARP did is, as we looked at the nursing homes, all kind of caregiving, so looked at nursing homes, we began to really advocate with our members to push and encourage our governor for transparency in nursing homes. So that was one of the big things early on that AARP worked on, is getting that kind of transparency with the 6 questions you should ask for nursing homes that might house your loved one. So that's something I'll give to Candace so that she can put it in the notes. Just a resource that you can go back and look at, because it's not going away, and there are still questions, but questions that you should ask. So that's one piece. The other things that we have today on the list is our AARP recognized the need also to be a friendly voice for people across the country. So they ramped up and trained 800 or 900 volunteers to be just a friendly voice. You might know someone who needs someone just to talk to once a week or just to check in, so you can get that for yourself or for someone else. And so that's our caregiving connections. And so you can click on there 9 to 5 each day. Also, there's a 24-hour part of it where you can just leave your information. So if you need someone to call you once a week to say, hi, how are you doing? You can put it in there as well. You can also join other people in the community through our mutual aid program who has some things to offer. And so we know that caregivers are up against it all the time, and we want to provide you what you need. And so it is a great privilege to be on this webinar with so many other great groups who are reaching out to caregivers. And one of the other things, so each week, AARP has a teletown hall that's open to anyone, and we'll have that number there with the CDC as well as different organizations and other folks. So it's caregiving, it's how to avoid scams. So there's a lot of different things that you have to be aware of during this COVID-19 time. Sometimes it's things that we don't think about. So we try to provide resources in those areas. And so our supporting messages, 1-888-281-0145 to set up a call for yourself or on behalf of someone else. As we always like to provide or mention is the Prepare to Care Guide. And I heard Toula mention earlier as she was speaking, saying, how do you plan? What is your plan? How do you find support? And we know it's not easy, but necessary. And so we want to continually provide that guide that some of you have if you've been to any of our in-person events. We try to provide that guide at all of those settings, but it's also online. And we also have a caregiving guide for veterans. We haven't mentioned a lot about veterans, but that is a specific area as well that we have resources. And again, we have a variety of virtual events. We have caregiving and coffee and conversation on Tuesdays, a 30-minute session. Anybody could get on any of these sessions. And so Candace has provided links to all of our different resources online. So if you have specific questions, get to the question and answer time. I am more than willing to answer those. And so again, one last thing I'll say that's a freebie, and Toula said it, we can't say it enough, is I encourage people to step away from the news because it is anxiety inducing oftentimes. The other is, if you will find 2 or 3 resources and sources for your information, because there's a lot of misinformation that also produces anxiety and just can be dangerous. So find yourself 2 or 3 trusted resources where you can go to get your information. So thank you, and thank you again for being here.
Thank you, Justine. And that's such a great point. I mean, the anxiety from that information overload is real. You know, we have a lot of different people and organizations and news stations that are all telling us, you know, different things, and it can be very overwhelming. So thank you, Justine. AARP has fantastic resources. Again, we're going to email this all out to you guys after the session. I have a few people asking questions in the chat. That's fantastic. Go ahead and keep doing that, and we'll get all those questions answered. So moving on, we have Milva Ballester. She's the programs manager at the Alzheimer's Association, the Central and North Florida chapter. The Alzheimer's Association has always kind of led the way in Alzheimer's and dementia education and support. So Milva, what kind of resources do you guys have right now that are accessible right from home?
All right, just making sure I was unmuted, but yes, thank you so much. I love the idea of being able to share some of the fantastic resources that we have available. And I want to start off with the helpline, which Toula mentioned. I really appreciate that. But just to kind of give you an overview about really what the helpline can do, it is a 24/7 resource for you. And the great thing about it is that you're able to talk to specialists and master's level clinicians that can offer confidential support, and also lots of information on really any topic that's related to Alzheimer's disease and another dementia. So that's a great resource for you to consider. And it is 24/7 and available in many different languages, over 200 languages. So if you need it in Spanish, you can call, let them know that you need to speak with someone in Spanish, and they'll get that over for you right away. The other thing that I wanted to tell you about was the Community Resource Finder. And that's actually in partnership with AARP. You just heard from Justine. And this is really fantastic for helping you locate specific resources that are within your community. So you're actually able to put your zip code and select what it is that you're looking for. If you're looking for example, in-home health services, you can select that option, type in your zip code, and it'll generate a list of what's around you. With all that's going on, this has also been updated to include the virtual resources as well. So it is up to date, and it's something that you can just access going online, alz.org/CRF. So Community Resource Finder, CRF. We also have our telephonic support groups. Of course, this is a little different than our in-person support groups. We do have about 12 or 13 ongoing support groups within the community that are in different parts of Jacksonville, St. Augustine, Clay County, and Flagler County. So there's a little bit of everywhere. But of course, with the concerns associated with COVID-19, we kind of had to act very quickly and transfer those over to a virtual environment. So we were able to do that by transferring it to a telephonic support group. The great thing about it is, though, that you're still able to join at the specific time and day of the week that that support group would take place. So once you get comfortable with going through that support group telephonically, when we get back to more normal socialization that we're used to, right? You can actually attend those specific support groups at that same time and that same day of the week. Now, I do want to mention something that gets brought up quite frequently with support groups. Each support group tends to have its own vibe, if you will, right? It has its own sense of identity. So you may find that for you to find a support group for you, it might take a couple of different groups for you to attend to find one that kind of fits with you, and that's okay. The great thing about this telephonic support group is that you can do that very, very easily. So if you can attend one support group and you're not really feeling that it's okay for you, or that you don't really, it doesn't really align with what you're looking for, then you can call another telephonic support group and see if that works a little bit better for you. Also, we have our virtual Brain Buzz and virtual Caregiver College. So both of these programs, of course, are virtually, and they're actually occurring live, which is great because it still gives you the ability to interact with the speaker. You can still ask questions, and those questions tend to get answered as the presentation moves along. Both of the programs are on Mondays and Wednesdays at 10 a.m., 1 p.m., and 7 p.m. And there's actually a schedule on that Community Resource Finder we talked about, so you know which specific topics are being presented on specific dates and times. Now, I will say that the virtual Caregiver College is super fantastic, especially, of course, for caregivers, because you're able to learn a little bit more about communication strategies, for example, understanding and responding to behaviors. And then there's also some information on legal and financial planning. So it really is fantastic for you guys as caregivers. The virtual Brain Buzz does offer understanding on the 10 warning signs, on a general understanding of Alzheimer's and dementia, what the stages are, what research is being conducted, and then also the healthy living for the brain and body. So they're all great comprehensive programs with lots of material and lots to learn. Now, I do want to mention that on May 26th, we're going to be having a Dementia Conversations program. And this is going to cover specifically some difficult conversations that revolve around dementia. And it'll cover some tips on kind of how to get those started. So this includes going to the doctor, also when it's time to stop driving. And then there will be some tips also on initiating a conversation for legal and financial planning as well. So Candace will actually be joining us for the Dementia Conversations program on Tuesday, the 26th. And we'll also be joined by Dr. Philip Tipton and Candace Jacobs Robinson. They have a podcast that's called Long Live the Brain. So they'll be there as well. So it's a great opportunity for you to learn a little bit about those conversations, how to get them initiated, and then of course get that support from the Alzheimer's Association, the Caregiver Coalition, and Long Live the Brains.
Great, awesome. Thank you, Milva. The Alzheimer's Association, like I said, they're such a valuable resource. They have so much stuff on their website and so many ways to connect. So thank you for sharing. I'd also like to share the agency that I work for, ElderSource. Every single person at the agency, we've all been working from home, continuing to serve seniors and caregivers in North Florida. So we have, as Toula mentioned, the ElderSource helpline. And I would say this helpline is the best place to start for help. Like I said, all the staff are working from home, so they're still answering the phones between 8 a.m. and 5 p.m. And they're connecting you guys to the resources that we have here locally. They can help you through the enrollment process for certain programs if you're eligible, and then they can also connect you to other resources that we have there at the agency, one of them being our SHINE department. SHINE is the Serving Health Insurance Needs of Elders, and this department is made up of volunteers that are trained on the ins and outs of Medicare and who can give you free and unbiased counseling on Medicare questions. The helpline can also connect you to our virtual caregiver support group. This support group is for any caregiver in Northeast Florida, especially if you're not able to leave your home, whether it's because of the COVID crisis or if you just have so many time-consuming responsibilities and you can't get respite and you can't get out. This virtual caregiver support group was created for you. If you're feeling isolated or frustrated or stressed, please reach out and call the helpline. It's the perfect place to vent and share stories and talk with other people in similar situations. The sessions are led by a trained facilitator, and all you need is, just like for this workshop, a computer, a tablet, a smartphone, and we can help you guys connect. Lastly, we have a program called Caring Connections, and this is a telephone reassurance program that was developed to help fight the loneliness and isolation that seniors experience while living alone or homebound. We have trained volunteers who make regular friendly phone calls to seniors to bring them a social connection that they probably wouldn't otherwise get. You can volunteer to make the calls, or if you know someone who would benefit from hearing from a friendly volunteer, you can call our helpline to connect them. If you're interested in any of those resources, or if you have any questions about what the next steps to take are, you can call the ElderSource helpline. The number is up there, the 391-6699. Or if you're not local, the toll-free number is there as well. So I think it's time. I'd like to go ahead and open up for questions. Remember, our experts are here to answer any of the questions that you have. I have a few that have come through in the chat box. I had also had a few that had been emailed to me, so I'll go ahead and read those off. For any further questions, if you want to utilize the hand raising feature, we can do that. Or like I said, you can keep putting them in the chat box and I'll read them off for everyone. I'll do my best to get everybody's questions answered in the time that we have, and make sure that any resources that are discussed, if they weren't already listed here in the PowerPoint, I'll make sure I get the information and I can send that out to you. So let me go ahead and open my chat. We had a question from Elaine. Elaine had asked, are there any adult daycare centers in Jacksonville that take wheelchair clients that are very alert but need a place to go for fun recreation for the day? She lives by herself at night. Is there a list of adult daycares, and who can she call to obtain the list? If anyone immediately has any kind of suggestions, go ahead. I know I suggest calling the ElderSource helpline. They have connections to a lot of these places, and I know some stuff might be closed and it's kind of unsure about regulations right now. So I do recommend calling the ElderSource helpline. Justine, you're muted. There you go.
Thank you. Another place that Milva talked about was the Community Resource Finder. You can put your zip code in, and it will tell you what resources are available in your community around your needs. That's one place as well.
I think I'll just add that I'm not aware that any adult daycare centers turn down people who are in wheelchairs. I've been in many of them, and
Right.
I've seen wheelchair-bound people. I mean, that's some of who they're there for. So go to either of those two resources and look them up. And we are lucky in our area. We have, in Jacksonville alone, we have about 20 adult daycare centers spread out.
Any other suggestions? I think
That's a great question, by the way.
it is a good question. Like I said, when, you know, a lot of places are closed right now, or you're finding that you really do need that engagement for your loved one during the day. That's a great question. So I had another question from Corey. She said, we need to move my mom into memory care, but we don't know how to approach this because she's aware half the time and we think that she's going to not want to go. So how do you kind of introduce, you know, moving into memory care, and what are the best ways to help with that transition? Anyone? Milva, are you trying to unmute?
While she's unmuting, in the Prepare to Care guide, one of the first topics is starting the conversation. And so there are some tools and resources in how to begin the conversation and come up with the plan. And that's online.
Sorry about that, Justine.
No, that's fine.
Thank you for unmuting me, Candace. I was going to actually suggest something very similar. We do have a page through alz.org that has tips on how to initiate a conversation as well. I do want to say that one of the things that has been found very helpful is involving your physician. And the reason for that is that a lot of caregivers find that that kind of helps show that that concern is not only coming from you as the caregiver, but also from the physician, and that recommendation has been made by your physician. So involving your physician can be very helpful as well. And then of course, you know, just having the conversation and trying to plan out for all the different things that involve that transition is something that will help as well. And I think Toula had mentioned that before about planning ahead.
There are a couple of companies in town that can help you with that. If anybody wants to reach out to me, I don't want to endorse any particular one, but there are 2 or 3 companies that will help you with that, and they'll help you find the right fit, the right facility for your loved one. And they actually charge the facility. They don't charge the family caregivers. So if that's something you're interested in, you can email me and I'll be glad to help you do that. It's a great service because they're familiar with every facility, the ins and outs of them, the DON, the administrator, all the things that they specialize in their memory care units. I think that would be a great help to any family member looking to place their loved one.
Right, and I do kind of want to point out, oftentimes, you know, we have some really great suggestions here on kind of getting the momentum, but most facilities will let you in to tour. And you can tour these facilities and you can talk to the nurses, you can talk to the caregivers, you can kind of really get the feeling for the community. And a lot of places will also let you retour and bring your loved one, you know, and it's not about making that permanent decision. Hey, mom, hey, dad, this is where you're going to live. You know, it's about bringing them in, introducing them, letting them see what it's like, you know, the possible social connections they can build, the activities they can do, show them what the food looks like. You know, a lot of places understand that this is a struggle, how that transition is really a struggle. So I would suggest really opening communication up with these facilities and with their executive directors and the director of nursing. And if there's one that you're interested in, you can pose this question to them as well. What's the best way for me to get mom or dad in and kind of ease that transition?
And they are all accepting patients during this crisis.
Right.
The residents, as they sometimes call them. Please know that, because a lot of people think they're not. but they are.
Yeah. So thank you, Corey. That was a really great question. A question for Milva. This is about the session on May 26th, the Dementia Conversation session. Caroline had asked, how do we attend the May 26th 1 p.m. session?
So you can actually go to the Community Resource Finder and register there. It is a free registration. We'll just need the your name and your email address, I believe. Or you can call the helpline as well, that 800 number that was listed on that page. I believe I'm able to write it on the chat, so I'll write it on there as well. And then I'm not sure if Candace, if you'll be sending some information along, but we have a flyer as well that has the direct link for that. So that way you don't have to worry about searching through Community Resource Finder. You can just open that up directly and register online in that manner.
Yeah, thank you. I will be sending out that flyer. I'll send you guys out information on the May 26th, the Dementia Conversation session, so that you can join if you'd like to. So I've got some more questions here. And we have
Candace?
2 minutes. Yes, ma'am.
Yeah, someone put in chat and I can't get on, but she asked, what is ALC? She wants to know about Alzheimer's, so it's a Z rather than a C. So if you
Right,
just make that question for her,
alz.org.
answer her question, thanks.
Yes,
Yeah, so the Alzheimer's Association website, alz.org.
Z as in zebra.
So I've got some more questions. Mary had asked, what is memory care? But I think we kind of resolved that question. But just so everyone else is understanding, memory care is an assisted living facility that specializes in residents with Alzheimer's or dementia. So many ALFs have a memory care unit or a memory care wing that is specifically so that the staff is trained on handling difficult behaviors and kind of the challenges that come with somebody that has Alzheimer's or dementia. But then you also have facilities that the whole facility specializes in memory care. So everyone in there, from the administrators all the way down to the cooking staff and the housekeeping staff, they're all trained on Alzheimer's and dementia. So I've got a lot of dementia questions here. I have one from Nancy. My father has dementia, mid-stage dementia. I have power of attorney. How much do I share with him regarding the cost of his care and finances? He does not know that he has been deemed no longer competent to determine medical, legal, or financial decisions. Does anyone want to tackle that question? I think this kind of comes down to the difficult conversations to have. I think this is something, Milva, is this something that we're going to cover in that May 26th session?
Yeah, so there will be some tips covered on starting that conversation for legal and financial. I do want to say that we do have more in-depth programs that are specifically focusing on those conversations, legal planning and financial planning. So they're two separate programs that can help with that. In general, I want to just kind of put out there that really is going to depend on the situation. So there's not one specific piece of advice that I can give in general. It's really going to depend on the whole situation at large. Who is your support system, who is involved, what your elder law attorney can suggest as well. So there really is quite a lot that can go from there. I would definitely suggest attending one of those sessions, the legal and financial planning session. And also, I know the alz.org website has a lot of information on that as well, available that you're able to just type it in the search box and pull it up from there. And that can at least help you initiate it, but it really is going to depend on all that is involved, everyone that's involved and what's going on.
Thank you, Milva. I hope that was helpful. Again, if you kind of want to dive further into it, it really might be beneficial to join that session, that Dementia Conversation session on May 26th. So I will be sending information about that out to your email. So we hope to see you there. We can kind of dive further into it. I have Fred in here. sharing just a few things, a few tips that I want to share with everyone as well. He said that the JTA connection can bring somebody from your home to the adult daycare center, whether or not you're in a wheelchair. He said that the JTA connection can bring a person in a wheelchair from the home to the daycare center. They would need to be certified first. They can find more info at jtafla.com or calling the connection number, which I'm going to make a note right now to include that for anyone that might be kind of running into transportation issues on getting your loved one to an adult daycare center, especially if they're in a wheelchair and you don't have, the proper accommodations. I'm going to make a note to get the website and the phone number to include in the email for you all. I have a question from Rhonda Sparks. She said, is there a program that can assist with nutrition, meals, and exercise since we are at home? I think that's a really, really great question on handling kind of the social distancing, physical distancing, I should say, protocols. And I know that we do have some resources available.
I'd like to just add that one of our Caregiver Coalition members, the YMCA, has a lot of virtual exercise classes they're sending out to everybody. They also have dietitians on staff who can help you. So I know Claire Watson-Irving is the general marketing director for all of them. Candace, if you could maybe send out her information after this. I get them at least weekly, all the virtual exercise classes that they're offering.
Right. Yeah, a lot of programs have gone virtual with the YMCA. Even if you just follow them on Facebook, they do live streams, and they have a schedule specific because they do anything from yoga classes to cardio classes. But they also in there, they do have classes that are targeted for seniors, things like chair yoga. And I know that they do more aside from what's on Facebook Live. So I'll share the information with everyone for those classes. Sorry, Justine, I didn't mean to cut you off.
No, just going to say that just on YouTube as well, you could put in specific questions or topics as far as exercise. So whether it's you're in a chair, you need to do a chair exercise or a chair yoga, all of those are available on YouTube channels as well.
And don't forget the exercises for yourself as well.
Yeah,
Yoga
absolutely.
For you.
And then I'd also like to just encourage you to check out the Mind Diet. That's a diet that has been kind of proven to help potentially help with the cognitive function. Lost my words there for a second. And you're able to find that as well at alz.org, but that might be something that you're able to incorporate when it comes to your meal planning, your cooking. And it's the Mind Diet. I'll go ahead and send that over to Candace as well to get that information over to you.
Thank you, Milva. Okay. Fred had made another really great point, kind of going back to transitioning into memory care. You can bring a loved one to an ALF, to a facility for respite care, and that means that it's kind of a short-term stay. It can either be like a day stay. A lot of memory cares have day stay programs where you bring them, for 4 hours at a time, and they can meet everyone and they can be involved in the engagement activities. They can stay for a meal, and then you can come and pick them up. You'd have to call the individual communities to see what the rates are. But then also the respite, you can, bring them there to stay for even just a few nights, or if it's for 2 weeks, or if you need to go out of town and, you really need, you're not able to hire someone to come in the home and watch them, there are options. So respite, you can get respite and bring your loved one to community, just for short term. You don't have that long-term commitment. That may kind of help with the transition and making them feel a little bit more comfortable with transitioning into a community. So thank you, Fred, for bringing that up. That's an awesome point. So I don't have any more questions in the group chat right now. We do have just a couple more minutes. I'm gonna pull up my email really quick. I had a question that I would really like to go over. from Kathy. She wanted to hear about the safety of hiring respite workers during this time. She said, I've put all of mine on hold since March due to them also working in nursing homes as well as other private homes. So is it safe to continue hiring respite workers? You know, how comfortable should we be? And what are other options, you know, to kind of have a break?
I would say the agencies that I'm familiar with, and I'm familiar with 2 or 3 of them here, I know they are temperature checking their staff to make sure that they're well before they go in to care for anyone. They're following all the protocols that one knows to follow, and they are indeed still sending staff to home.
Yeah, I think that's great. There's kind of an emphasis on the hygiene and an emphasis on making sure that you're safe. And, you know, I really feel like that can kind of be on an individual basis. It's what you're comfortable with. You know, it may depend on the schedule, whether you know that your healthier worker is coming in first thing in the morning before they've gone out and mingled in public. You know, there's also, you know, changing clothes right before you come into the home, washing hands, taking the shoes off. You know, there's kind of different things that you can accommodate to with bringing someone into your home that's going to help with your loved one. Does anyone else have any other points on that? I think it was a really good question too.
I agree with what you're saying, Candace. You know, there's a lot of different factors that are associated with that. And I would just recommend to just look over what the recommendations are, you know, from the CDC guidelines on what it is that can be done to help protect, you know, yourself and others in a situation like that. And, you know, Candace named a few, but it's just good to maintain familiarized with that kind of information. It feels like we are kind of in a cycle where we get new information every other day or so. So it is difficult, tends to get difficult to kind of get up to date with that. There are sources. I know that we talked about the stress associated with keeping up with all the information, and you know, I completely agree that you kind of have to take that time away and just, you know, take it easy in that manner. But there are sources through, for example, the Alzheimer's Association has even a page dedicated to give you those updates without you having to go through all the research, you know, through online or watching the news every single day. So that way you have that information available and it's concise, summarized, and that can be applied.
Thank you, Milva.
Mm-hmm.
So I'm sorry, I overlooked one question in the chat, and this one is directed towards Toula. And I know that it's 11 a.m., but I do kind of really quickly want to answer this question. Toula mentioned taking 30 minutes for yourself. How do I do that when my loved one doesn't want me out of their sight?
I know that's a real concern sometimes, particularly with dementia patients. My father went through that with my mother. She wouldn't let him out of her sight. He couldn't leave the bedroom sometimes. It's not an easy thing to do. You're going to have to find a distraction for your loved one, whether it's getting them involved in a book or music or a puzzle or something like that, so that you can step away for just a little bit. If it's safe to do that, I mean, that's the biggest issue right there. Know that they'll be safe for 30 minutes for you to do that. And if that's not going to work, is there another friend or family member that you trust that can come in to be with your loved one? Everybody has somebody that they feel like they can trust to tend to their loved one, and that's so important. You can't do this alone. So try to find someone who can come in and give you that break that you so desperately need.
Thank you, Toula. Anyone else want to add anything? Okay. So we've kind of reached the end of our time. Oh, Caroline, I see your question. Oh, she had asked, where did you say the respite community is? Different communities have different policies on respite. you would really have to reach out to the individual community. And I think that might be something to, Milva, is that something that they could find through the community resource finder?
Yes.
Yes.
There'll be an
Communities
option
offer the respite
specifically for
services.
respite. Yep.
Mhm. Okay. And she said also, where can a single person who gets COVID-19 get a caregiver for home services, for meals, medication, and care, et cetera, et cetera?
I would reach out to Aging True. You guys want to add anything?
No, just please call us at 904-807-1203.
Mm-hmm. Yeah, Aging True offers those services, and those services are still going on right now, even during COVID-19, right?
Right, because we always practice universal precautions.
Mm-hmm.
And I know for Meals on Wheels, because I've talked to the CEO at Aging True, that y'all are actually doing more than one meal a day. For
Yeah,
a lot
absolutely.
Of years.
We've partnered with
we
partnered with restaurants as well to extend our reach.
which is just fantastic.
Mm-hmm.
That's
Yes,
awesome.
absolutely.
Yeah. All right, so I had checked my email just a minute ago, and I see that I kind of have a few more questions in there, but just because I know, even an hour might be a lot of time to commit for some caregivers, I want to go ahead and kind of wrap this up. If you do have any other questions, you can send them to my email, or you can go to our website, caregivercoalition.org. And there's like a contact form at the bottom of the page. And if you fill that contact form out with your information and your question, that gets sent straight to my email. So I will get that and I will answer that as soon as I can, or just connect you straight to the resources. So thank you so much to all of our panelists, all of our experts. You guys are experts for a reason. I really appreciate your time, and I think that the information you shared has been really valuable for caregivers in our area. I mean, we have, I saw we had 63 people in our session, which is really, really great. So thank you so much. I do want to share that we're going to have another virtual caregiver workshop next month. It's going to be on Saturday, June 20th from 10 a.m. to 11 a.m. And we are going to talk about the legal aspects of caregiving. We're going to have an elder law attorney join us and share about the importance of having those financial documents and having those advanced directives and kind of situationally what they're important for. And then just like today, we're going to have a Q&A session where you can ask those difficult legal questions and get them answered by an elder law attorney. We do have elder law attorneys that are members of the Caregiver Coalition. So those are resources that we can absolutely connect you to. So I'll send out information out as soon as the details unfold. I'll send it to your email. I encourage you to check out the newsletter and subscribe if you haven't already. You can do that at our website, caregivercoalition.org. Subscribing to that is how you receive the updates and the information on these sessions. You can also like us on Facebook to stay in touch. We post a lot of updates on Facebook. So thank you to every single person that attended this session, our very first session. We really appreciate it. I hope you're able to get information and resources that kind of help you on the rest of your caregiving journey. And hopefully you found some support and some help to kind of ease the mental and physical burdens that might be associated with, taking on so many responsibilities and taking care of yourself and taking care of another person. I'll send out an email, like I said, that's going to include all the resources we covered today. It's also going to include a little survey, and that's going to help us improve these sessions in the future. So please, if you can, take the time to fill that out. So thank you to everyone for participating. Hopefully we see you next month. Enjoy the rest of your Saturday.
Thank you, Candace.
Thank you.
Thank you all.